What I'd like to do over the next 20 minutes is provide an introduction to the Qualitative Systems Exploration Model, or QSEM. It's an approach that helps us move from causal loop diagrams through to gaining actionable insights. I'm going to cover three things. The first is just some background context to how and why QSEM was developed. I'll then speak about what QSEM is. And finally, I will give an example of QSEM in action and also using some of the software functionality. So complex challenges are everywhere in the 21st century, from the population prevalence of overweight and obesity through to the high levels of physical inactivity and the inequalities that exist across a whole range of health-related outcomes. These are complex issues that are driven by multiple interconnected factors that lead to these emergent outcomes. In this case, these negative population health outcomes. So how then can we start to understand the complexity associated with some of these 21st century challenges? Systems mapping techniques are one of the approaches that can help us to do that. Each of these different techniques or methods can help us to understand various things about a particular system and where we might be able to intervene within it. Now, some of the methods, more to the left-hand side of this spectrum, they help us to understand that a system exists, that it's made up of multiple component parts, and that there are relationships between those parts. As we move towards the center of this spectrum, there are methods that help us to understand that these systems behave in particular ways. As we move over to the right-hand side, there are methods then that can help us to understand there are things we can do to intervene in these systems, and that some points might have more or less leverage than others for driving systems change. And at the far right-hand side, there are methods that can help us to anticipate what might happen if we intervene in particular parts of the system. Now, the thing with this spectrum to remind ourselves of is that the further to the right we go, the greater the amount of insight we can gain, but the more time, resource, and specialist expertise is required in order to get there. So looking at the techniques available, towards the left-hand side, we've got methods such as rich pictures, which help us to understand that a system exists and is made up of multiple component parts. When we move more towards the middle, there are methods such as participatory systems mapping, causal loop diagramming, and fuzzy cognitive mapping. Going further again to the right, this is where the computational approaches come into play, such as agent-based modelling and system dynamics modelling. But as I said, the further to the right-hand side we go, the greater the time, the resource, and the specialist expertise is required in order to fully utilise them. Now, if we look at the ways in which these methods have been applied across the public health literature, there seems to be quite a lot of consensus. It is the causal loop diagrams that are most often used in order to try and understand how a system behaves, and to some degree, and in some studies, to start identifying potential places for intervention. So the question that we wanted to then ask, given that causal loop diagrams seem to be most often used in a public health context, is how can we start better utilising or maximising these causal loop diagrams to gain deeper insight without requiring much more time and resource of the stakeholders who often take part in those group model building workshops that are used for developing those causal loop diagrams. So in other words, how do we move these causal loop diagrams further towards the right-hand side of this spectrum without, as I say, requiring more time, more energy, more resource from those stakeholders who are often quite time poor? And this is where the Qualitative Systems Exploration Model, or QSEM, can be particularly helpful. So for the remainder of this talk, I'll give a brief introduction as to what it is. And if you want to read more about this and the underpinning methods, then there's a paper that was published towards the end of last year in the System Dynamics Review, which was led by Adam Holm. So what is QSEM then? It's a semi-quantitative framework, and it has some freely available software that can help us to explore how a system is structured and organised, and to identify some potential points of interest from an intervention and action perspective. Now, we can bring a fully developed causal loop diagram into the QSEM software if we have one, or we can use the QSEM software to build one of these causal loop diagrams. Now, many of you, particularly if you're working within a public health domain though, you might have access to a good quality causal loop diagram already that you can use as your starting point. Now, the main requirement and request of stakeholders when using QSEM is that you get the group to agree on and assign impact, control, and time delay scores for each of the connections within a causal loop diagram. So when we talk about impact, we mean the degree to which factor A has an impact upon factor B. When we talk about control, we mean the extent to which we can control that relationship between A and B. And when we talk about time delay, we mean how long it will take before we see an impact from A on B. And this is the part of the process that makes QSEM stand apart. It really emphasises participant judgment and group discussion in assigning those scores. So that's something really to be aware of, that those scores that are attributed to your causal loop diagram are solely dependent upon who's in the room when assigning them. In order to bring this to life a little bit more then, I'll draw an example of some of the work that we were commissioned to do by the Welsh Government. And this is where we first used and developed QSEM. But rather than focusing on the entirety of this work, which was trying to understand the factors influencing dietary choices in Wales, I'll draw upon one particular sub-theme and causal loop diagram as an example. We were commissioned by the Welsh Government in 2023 to use some form of systems mapping to identify those factors influencing dietary choices of Welsh households, and to begin surfacing potential places then for policy intervention. Now, the insights that we developed through this work, alongside the wider work that the Welsh Government were doing, were taken forward to try and support a shift towards healthier and more sustainable population diets. And it was within this, as I say, that we first developed and tested QSEM for the first time. Now, there are 4 key steps when applying QSEM, and I'm going to go through each of these in turn with the particular example that we've got. So the first is the development and verification of a causal loop diagram, if you haven't already got one available. The second, and this is the main activity in the additional ask when using QSEM of your stakeholders, is to get them to assign impact, control, and time delay scores. Third is the analysis that QSEM then does, but it does this automatically and behind the scenes. And then lastly is using those particular features in the software to gain deeper insight as to how the system functions and where we might be able to intervene. So step 1 is all about developing the causal loop diagrams. In the work with the Welsh Government, we developed a baseline causal loop diagram by doing a systematic review of the literature to identify the pre-existing systems maps of the factors that were driving dietary intake in particular population groups. We then took those 9 pre-existing maps and synthesized them all together into one overarching map, which is what you can see on the slide here at the moment. Then, in order to make this more usable and useful, we broke it apart into smaller subsystem causal loop diagrams, where we split this diagram up into 7 of these causal loop diagrams. And these look a little bit like what I'm showing you here on the screen. But in order to ensure that these were contextualized to the Welsh settings, we refined these causal loop diagrams through participatory workshops with members of the Welsh Government. So we ended up with 7 of these that looked a little bit like this one, but for the rest of this presentation, I will just stick with this one example to help bring QSEM to life a little bit more. Step 2 is the main one really, where we're working with stakeholders to assign impact, control, and time delay scores. Now, in our work with the Welsh Government, we did this through in-person workshops, but you could also do this in an online setting and actually just use the QSEM software straight away. We asked participants then to agree on and assign those scores. Now, when we did this, Impact was scored from 1 to 3. So 1 being limited impact, 3 being high impact from A on B. And this, when you double click on those green dots, it brings it up. It makes it really easy to do this scoring. Control was scored from 0 to 3. 0 meaning that we have no control or influence over that particular relationship. 3 meaning that we have a lot of influence over that relationship. And then lastly, there's the opportunity to put information there about time delays. Now, this wasn't part of our original approach, so we don't have that data to put into here, but it's very much part of the software as it stands right now. In terms of additional functionality as well, and to increase the sensitivity, we've also got 5-point and 7-point scales rather than those 3-point scales that we were working on beforehand, and they might be more helpful in your particular context. Step 3 is the analysis that QSEM runs, which happens behind the scenes. So you've done all the hard work already with your stakeholders in terms of assigning those impact, control and time delay scores. But what I want to do is show you what happens with those scores once they've been assigned. So what QSEM will do is it pulls those scores through into this matrix here to calculate the active and passive values. In other words, the degree of influence that factors have and the degree to which they're influenced by those around them. Now, depending on the scores that they get, those scores then pull through, and for each factor, they get plotted into this system grid, which is shown here. So dependent on which of the 4 groups then a factor sits within, it tells us a bit more as to whether or not it might be a factor for intervention or simply a factor to monitor over time. So the ones that we're particularly interested then, quadrant-wise, is the top left-hand corner, which is what we would refer to as steering factors. So these are the ones that have more of an influence upon the system than the system has upon them. So ultimately, they influence how that system works. And the other that we're interested in is in the bottom right-hand corner, which are referred to as like the measuring factors. So these are the ones that are highly influenced by those around them, but they don't really exert too much influence on the other things and the other things around them that are happening within the system. So what QSEM does, which is quite nice, is automatically color code your causal loop diagram by how those factors are being categorized into the steering, the measuring, the autonomous and ambivalent factors. And as you can see here, the green ones are the measuring factors and the red ones are the steering factors. So straight away, we are gaining more insight from these causal loop diagrams than we otherwise would have done if we hadn't have used the QSEM approach. So that then takes us into the 4th step, which is all about playing around with QSEM to gain deeper insight from the system that you're trying to explore. In order to do this, we can turn on the phase 1 coding, which this will do in a moment. If you look at the bottom here, you'll see 2 sliders. If we pull this slider all the way to the left-hand side, it means that within our causal loop diagram, we only account for how much impact factors have on one another, regardless of whether or not we can influence them. If we slide this over to the right-hand side, though, we account only for how much we can control those factors, regardless of whether or not they're impactful. Potentially the most useful slider, though, is this one underneath it, which is the depth. So if we just look at these 2 factors alone that are being highlighted now on the screen, if we pull the depth all the way to the right-hand side, it allows us to understand how one factor's impact propagates throughout the entirety of the system and not just on those nearest to it. So you can see that factor there changed its categorization because of that depth slider. And now finally, on the right-hand side of the screen, there's a feature that allows you to identify particular feedback loops of interest. If you click on that torch tool, it then highlights those feedback loops in your diagram so that you can begin to understand them better and also tell more of a story around them. It's worth noting that in the work that we did with the Welsh Government, we did all of this process manually first. And if you want to read more about that particular piece of work, you're more than welcome to scan that QR code and that will take you to that report that's hosted on the Welsh Government website. But as I say, we did that process initially manually. But now we've got the software available that's on the right-hand side of the screen. And I've tried to give you throughout this talk just a little bit of a demonstration as to how it works and what it can do. But ultimately, it automates a lot of that process for you. All you need to do is work with your stakeholders to assign those impact, control, and time delay scores. So just to bring this to a close, QSEM is really helpful in supporting people to pay more attention to the interconnections within a system and to leverage deeper, more useful insights out of it. We haven't and we don't want to try and position QSEM as a replacement for full system dynamics or computational approaches. It's really about helping us and our stakeholders to gain more insight from those causal loop diagrams that lots of us are already working with in these spaces, without actually needing too much more time and information from the people who are involved in those group model building processes. There are some limitations too, though. As I mentioned, we broke that big picture systems map down into 7 subsystem causal loop diagrams. So we're not looking here in this analysis at how those subsystems connect to one another. And we made a decision to do that so that it became more feasible. But it does mean that those factor classifications, that some of which I've just shown you, might have looked different if we'd have based the analysis on the big picture as a whole. And then the final and potentially most important point, just to reiterate, is that the whole process and therefore the resulting outputs are reliant on who's involved in those stakeholder group model building workshops. If we did this process with a different group of people, we may well get different outcomes. If anybody would like to get in touch or ask any further questions about this, my email's available below at the bottom of the slide there. But thank you very much, and hopefully that's just given a nice introduction to QSEM and what it can do.